elitist doctors, not the ones in the AMA and not the ones in the Mayo Clinic with big salaries. I'm talking about us, the working doctor, the one that went to medical school, the one that started his practice at the age of 30, the one that took hundreds of thousands of dollars of loans out, had to start a practice, hiring people, working in our community, and basically being the patient advocate. That's the working doctor. And recently, especially with this healthcare bill, I began to see no one asks us what we think about the bill. No one asks us what's happening to our reimbursements. And just for instance, we run a practice, and running a practice is running a business. And over the last 15 years, we've had no increase in any of our payments. As a matter of fact, we've only had decreases. But our bills keep going up. Health insurance, malpractice insurance, electricity, taxes. So we're at the point where many doctors are right at the verge of whether they're going to continue practicing or not being able to practice. So when we look at a healthcare bill that's passed with our representatives, and one statement that really bothered me was, let's pass the bill before, and then we'll let you know what's in it. And that was a true statement. That was a true statement, and we have no say in any of that. So looking at how doctors can become involved, and doctors are passive. No matter when we go into the hospital, or no matter when we have a meeting, the conversation goes to what's happening to us as far as malpractice, what's happening to us as far as the hospital is concerned, what's happening in reimbursements, and everybody's depressed. But doctors are not passive. Doctors are unable to organize. If anyone knows doctors, if you ask 2 doctors one opinion, you'll have 3 opinions. If you ask 2 doctors to contribute to something, it's very difficult. So doctors are entrepreneurs, and they don't seem to want to band together. And that's what they've been using to stop us from organizing since I've been a doctor. So we have to get into the game. And how do we get into the game? That's why Doctors for Change was started. Where does our power lie? Well, let's say there's 9 million people in New Jersey. Well, they go see the doctor every year, maybe twice a year. And I don't have to ask you, but after you discuss the medical problem with the patient, the next question is, what's happening with the politics of medicine, what's happening legally in medicine? I mean, we discuss this every day. So the patients now want to be informed. So where's our power? Our power is discussing the issues with the patients. And we have a captive audience here. So how do we do this? Well, first of all, Doctors for Change, let me explain how Doctors for Change will work. It is an organization, it is a webcast where only licensed New Jersey physicians will be allowed to join. And in our Doctors for Change, we will have a forum. The forum, any of the doctors can discuss whatever they want on this forum. No one else will be able to see this. In the forum, we hope to get different ideas so that, for instance, we're going to poll the doctors. And we're going to poll the doctors on certain questions. And we're going to release this information at times either to the media or to a sister website which the public can sign on to. We will have the Doctors for Change website and the sister website. Steve, our lawyers that will help us navigate all the changes that are occurring with the new legislation. And what I'd like to do is teach the doctors what's happening on a day by day and week by week level so that we can be informed. And at the next level will be to teach our patients. Eventually, with the polling questions that we pull out, with learning what's happening with healthcare from a legal point of view, with discussing this with our patients, hopefully we can then start getting in a certain direction. Now, in order for this to work, we need as many doctors to join as possible. Now, if let's say there are 60,000 doctors in New Jersey, we can get 2,000 or 3,000 or 4,000 doctors involved in this, and we'll have substantial funds. We can then start sending infomercials out to the public of what the doctors in New Jersey of this group feel medicine should go. Remember, we're part of the community, we're the patient advocates, we're the ones that are in the trenches, and we're the working doctors, not the elitists. So we're the best ones to decide how medicine should be practiced.
What they did was because they started the coding system in English from the government in order to run this coding system. So the $70 million from the government.
300 million.
whatever it is. AMA is really our enemy. They're not our friends. And I think people should know this, that they are for this healthcare business for monetary reasons and not for health reasons.
Get out. The AMA owns the diagnosis, the DRGs, and somehow the number comes out 300 million they're getting because of those DRGs. With the new healthcare plan, and I'm not sure of the right numbers, but it was quoted somewhere in a news program that they will get $2 billion a year with the new healthcare plan that's in. So the AMA, you're correct, I don't believe is representing the doctors. The Medical Society of New Jersey, it's a good society, but I don't think that they are representing what's happening to us. We see what's happening every day, and I fear where medicine is going within the next several years. Our patients are fearful, and we have to try and develop a way to direct this in the way that we feel is proper. And right now we have no say, and this is a way I'm hoping to organize doctors and at the same time help us change some of the legislation to bring it back to some reality. Not, let's pass a bill and then I'll let you know what's in it.
But I think,
right.
Chuck, you know what, this is something that's been going on for years, though. I remember probably 15 years ago, a medical society meeting at Squires Pub, and Vince Maresca was there, who was the legal advice.
He's the executive director of the Medical Society.
The Medical Society. And he was talking about what's going on now, how the HMOs are going to ratchet down our fees. I said, well, what can we do about it? He goes, don't even try to go against it. He goes, you just have to join as many and take whatever fees they're going to give you. I said, we're paying you to give us that kind of advice, and this is basically, you know, what we've been doing is just saying, you know, hit me again, it's okay.
Are you looking to expand this nationwide, or?
Well, basically, we're going to start this over the next 3 to 6 months. We're going to see how many doctors actually join. And if we can get a critical mass of doctors and we can start organizing them in New Jersey, we will have a New Jersey chapter called New Jersey Doctors for Change. However, we would be ready to launch in New York, Florida, Texas, once we see if it works out here. And there will be an umbrella corporation which will help with all the other states. For years we really, talk about it, and I think we're passive. And you can go to any doctor's office in a hospital, and this is a discussion, but nothing gets done. And we have to figure out how to get started doing it.
One last question. You mentioned that you're trying to get, X amount of doctors so far, and the thousands of doctors in New Jersey. My question is, how can individuals help that aren't doctors, businesses, professionals?
Well, basically, what
are you looking to get them as members to?
Well, no. What we're going to do is the website basically is for licensed physicians, but we will have a sister website. The sister website we're going to put information on for the public, and the public can also ask questions. Now, if in that website people want to donate to our cause.